Hello, many thanks for always keeping it Ebro Africa. My name is Linda Alela and this is News in Focus. Last week we had an incredible session. We were talking about sickle cell anemia, of course, in solidarity of the sicklers in the country and ahead of the sickle cell month. Actually, it's Sickle Cell Awareness Month, and we want you guys down there to get to understand what is sickle cell. And as I said earlier, that particular time, it can be on your case this time around, and it can be on somebody else's case this time around. So we do not have reason whatsoever not to understand this particular condition. And on set, I had an incredible couple who shared their story, and we also had a doctor, Dr.Fatma Abdallah, who is here today again to shed more light on sickle cell. We left it at a wide range. We took time to understand the symptoms. We took time to understand what sickle cell was. We took time to understand the causes, and today she's back again to shed much more light, and she is joined by incredible young men. We also want to understand how they take sickle cell, how they understand sickle cell. They are warriors, and of course we're just going to have an incredible session. So you need to stick around as we get to know the guests of the day. Karibuni sana, many thanks for finding time to be here with us. Right next to me is Brian Oyugi. Brian Oyugi, like I said, he is a warrior, and of course following is Dr. Fatma. Shukran sana for coming back again. And finally, we have the Sickle Cell Ambassador, World Africa Sickle Cell Ambassador. He is Joe Mudukiza. Mudukiza, that other name is just tough. I don't know if it's South African, if it's Kenyan or anything, but karibuni sana. Mudukiza is also a warrior. So many thanks once again. And we left it at courses last week, Daktari. We got to understand the causes, and here we are. We have young sicklers. We have young guys who have sickle cell. They are warriors. They fought the battle. They're still fighting the battle. And I think it would only be fair for us to get to understand, to get this awareness to the young tax even more as compared to maybe the couple that we had earlier on. I remember Richard and of course his wife were like, okay, we're not going to get kids. Like, we're leaving it at 2 kids. Then what happens to these warrior kids that they had? And you know, what happens to these other young tats who are out here? Because like we said, the key thing that we want here is to at least ensure that we reduce sickle cell cases. So I think we're here, when you're having Daktari, we want you to talk to these kids and the kids out there so that we just get to understand, and of course to the parents, so that they get to take the messages to their kids.
That's true. Thank you very much. So I think the important thing for people to know is, once they have this condition of sickle cell, is that they should accept it as like any other condition that people have: diabetes, high blood pressure, all the other conditions. It's not witchcraft, it's not the devil's what, it's just a medical condition. And so they need to learn how to manage it. They need to learn how to keep themselves healthy, and of course they have to understand that they have to take medication, some of them for life, and they also need to understand that as they grow up, they are normal people. They would of course want to settle down and have a family. What should they do? And how can they understand it, so that when they are now getting into friendship with a girl, what is it they should explain to this girl so that she doesn't freak out and run away, so that she understands it, and so that she will even be more sympathetic, like Richard was last week. Very excellent gentleman. I think once people are given the information and they see it's not a death sentence to have sickle cell, you can live a normal life, a productive life, then you don't really have to get freaked about it, and you do your best. And we do have in Kenya people who've lived many years now by just managing themselves and understanding that this is what I have. I must not do 1, 2, 3, 4, and to help myself live healthily and avoid going to hospital too many times, I must do 4, 5, 6. So that's really what it's about. And I would like to say that when I was studying as a medical doctor, actually warriors like the ones we have didn't used to survive. Most of them would pass on by their 13th, 14th birthday. But thank God, with better medical care, with better knowledge, and with specialized care that we give them, we now have them going on beyond and having children, and I'm sure soon we'll also have grandchildren.
All right.
So the future is bright for these young men, and I would encourage them to keep on keeping on and not to give up. They can do, as Obama said, I can do it.
Yes.
You can also do it.
Speaking of that, I think I've gone through his story. We've shared a bit, and like he says, he posts his laser time. He was told by the doctors that yes, probably tomorrow, the day after tomorrow, you won't be no more. And I'm thinking, he's a man who soldiered on, and he says the future is bright. Actually, I think that is his slogan. And here we are, we're seeing him today, and I must say that's such a great thing. But it needs support. We must agree that it needs support. And I'll pose this to you, young guys. Probably we'll start by you, with you. What has your journey been like? And you're now at 29, as you put it. And I'm thinking, at 29, you're thinking of marriage. How is it for you? Let's even start, dating. For him, I'm sure it's dating. 22, it's dating. We're coming to your dating story. But for you?
Okay, my journey with Sickle has not been, it has been quite challenging in terms of maybe, let's start with the relationship issues, because that is what I'm undergoing right now. I had a girlfriend, and sometimes back when I approach her and tell her that I have this condition, the girlfriend was sometimes surprised and like that, but he said, let me give in. But when we are with her at the house and this attack came, and when the pain comes, you can't sometimes do much, you can't do anything. So actually from that scenario is when we broke up with the lady, because she feared a lot, and at a point she told me that she doesn't want to become a widow
So
at an early age. So
widow sentencing death or someone here. All right, I think I'll just cut you short on that.
Yeah.
Number one, we also want to understand, is the government doing enough? Is this awareness being created enough for the people out here? Because before it even starts with us out here, the warriors themselves, they're given this information and all that. And I'm thinking for Brian, it would only be fair enough for him to decide that next time I want to engage a girl, I'm not going to tell them of my condition. You would feel the same. And we would want to listen to your story, like your story, relationships. Have you started dating? Have you dated before? Something like that.
For me, I have dated. I actually started, I was very naughty. I started dating when I was 19.
Your mom should be hearing this.
I had a girl, she knows.
Yes,
I had a girlfriend. And actually she died. She had sickle cell.
Oh, Dr. That's one thing that we want to talk about.
Yeah.
Is this information being told pretty well? She has sickle cell, you also have sickle cell, and here you are dating. I need to pinch you.
So she had sickle cell, but unfortunately she passed on, and we buried her. I'm into another relationship. The other one that I have right now does not actually understand much about sickle cell, because she's not a carrier and she does not have sickle cell, but she knows I have sickle cell, because I actually don't take chances. I need to tell them that this is who I am and this is what I'm doing. If you need to get into a relationship with me, you need to be aware. So we have a little bit of misunderstandings, but I think we'll sort it soon.
All right. Yes. Reason why I said I want to pinch is because I think I've had a session with Dr. And Dr. says, if we are trying to create an awareness, and if we are trying to reduce the number of sicklers that we are having, and even in the future, then it means a person with sickle cell should not get married to a person with sickle cell. Supposing your girlfriend did not pass on, may her soul rest in peace, how far were you willing to take it? And that would mean, if they would have gone far, we're getting other kids who have sickle cell. And now the circle starts again. And this is even worse, because there's a mom, there's the dad, and the kids now. And the crisis comes. What happens? I think the best thing I should ask from you, Dr. is tell us who should marry who, Should we go for screening? Should we do this? So that at least we get to avoid these cases.
Actually, that's very important. I remember my late professor.
Yes.
He always advised the patient, especially the young teenagers, that when you get into a relationship and you begin to like a girl or a boy, bring them to me so that I can counsel them and explain it from the doctor's point of view. What is sickle cell? What are the chances? What is the future like of your relationship? So that at that point, that other partner can be tested. Before the relationship goes too far, they get tested, and then once they're tested, now we can give further counseling. Like with HIV, you do pre-test and post-test counseling. So that once the results come out, and we are the ones, we are the specialists in this condition, so we have the test. So we do the test, and then after the test, now we sit them down and say, okay, you have it, you don't have it, or you both have it. This is what your chances are. If you decide to go ahead with a relationship and have children, these are the chances of you having the children with sickle cell. And at that time, like I told you, because in Kenya, warriors would not go beyond their 13th and 14th birthday. At that time, my professor used to advise all couples, don't have children. The children will suffer, you will suffer, and your life won't be, because at that time in Kenya, nothing was available. Yes. And even in the world, there wasn't much available. But now the situation is different. The situation is that we can manage it, and we are helping them live to a ripe old age. We can, and if they can afford it, there is also an option of going for a bone marrow transplant abroad. That's not something available in Kenya. But if they can afford it.
And it's workable 100%.
Well, let's say it's still in the experimental stages, but it is being done. So you can say there's light at the end of the tunnel. It might not be so effective now, but maybe with time and with more research and more doctors working on it, they can improve it and make it better and better. So there's that option. Of course, the other option, which is in Kenya most people wouldn't accept, is that you allow this couple to go on with their relationship and conceive. Immediately the woman conceives, you test that unborn baby. And once you've tested, and you have to do this test very early in pregnancy, because the Kenyan law allows medical termination if the pregnancy is less than 3 months. So if we do the test before then,
and we tell the baby,
and then we find out that that conceived baby has full-blown sickle cell, then we can give that couple the option of terminating that pregnancy and trying again. Because though I explained that there's a probability of 1 in 4, but as my professor used to say, those eggs in our bodies don't read books. They don't know it's supposed to be 1 in 4. You know, it can happen 3 children consecutively have it. So that's the other option. But it's an option that most religious people in Kenya don't want to accept, even though the law, the constitutional law in this country does give doctors and specialists like us that window to sign for a medical termination. But then there are those other issues. So it's a catch-22 situation, but at the end of the day, it's better we inform each other. That way, those who don't know will get to know. Those who don't understand will get to understand. And that stigma that surrounds this condition is going to be reduced. Because when people know, oh, it's a condition, you can go to hospital, you can get treatment, doctors are seen, nothing with witchcraft, then the stigma will go.
Well, great. I'll come to you, Joe. You have told me that you've not had a crisis for the longest time now, and I want to understand how you've been managing this. But before that, let's talk to Brian again. Brian, now you're saying that, yes, you broke up with your girlfriend. I don't know what your plans are. I don't know how you're going to put it. I don't know if you got the fear of telling now the next person who will come on board whether you have it or not, sickle cell or not. But then, I think at some point in time, the doctors have told you about family planning, and last time we mentioned about it, Kidogo. Like the best family planning, just in case today somebody comes on board and they agree that, yes, I'm going to live with Brian and I don't have a problem with that, I'll fight, along with him. what do you do in terms of family planning? Because you do not want to give birth to kids again who are going to suffer, and you watch them suffer. You know the kind of pain that
Okay,
it
first of
entails.
all, as the doctor have said, for me, it is my life. Living with sickle cell is my life.
Yes.
So if I get a girl, I'll tell him that, I'll tell her that I have this condition, and this is what I'll want you to be doing, this and this and this.
Right. And of course,
And
you have to have the girl screened so that they are not a carrier, and neither are they a sickler, right?
Right.
Yeah, that is right.
Okay.
Yeah, but for the part of family planning, I think
Dr. will expound
Dr.
more,
can
but you
expound
must have
more,
been told
but
at some bit, because if you're not told, then it means
okay, okay. At some point when we have, okay, I have a group. I'm a member of a Children's Sickle Cell Foundation, and that group sometimes we have discussions with my peers and other. And what I've found out that most sicklers use the natural family
Way.
planning,
All
natural
right.
way. They don't go for the other hormonal things.
Yeah.
So for me as a patient, I don't know much.
Dr.
It
you need
reads
to
so
tell us
Dr.
much. Yes,
Yeah,
because
Dr.
these are delicate people, and you know they're taking medicine and all that, and of course bringing in something else into their body, then it means you're expecting some changes. And there are a couple of things that you're not allowed to eat, right? And there are things that you are allowed to eat in you know, there are others you're told you can eat, but in small portions and something like that. So what would be the best method of family planning for such?
Absolutely, I think natural would be, because chemicals and drugs would affect, have their own effect on circulation. And remember, we talked about the circulation. And so, for sure, for example, like the oral contraceptive pill, it gives a high risk of slowing down the blood flow. Already sickle cell slows down blood flow. Now, if you add this other drug and you slow down it even more, you're going to be in crisis all the time. So the best thing for them would be the natural method. So I agree with Brian, and I think with the counseling. But more importantly for Brian is, I know the heart cannot choose. He might fall in love with a carrier, you know, but if it's possible, if it's possible, then to reduce the risks of Brian getting children with sickle cell, the recommendation would be that he would have a partner who is normal. Because like Richard and Ruth, at least it means that their children will be carriers. And carriers usually have no problem. In fact, they walk around and they get on with their life and nobody knows. But those other carriers, we need to know. We need to test them so that we can counsel them and tell a carrier, try to avoid, if possible, to have a partner who is a carrier. Exactly. So the idea would be, I think, with Joe, is to get as many people from those provinces or those counties in those areas of Western, Nyanza, and Coast to come out and get tested to know their status. Like the way we've asked people to come out and know their status of HIV. So now we need to ask people to come out and know their status of sickle cell, if they come from those areas. Or if they have, maybe somebody is in Central Province, but the grandmother was from Western, or the grandfather was from Nyanza. If more and more of these people can come forward and get tested, first of all, we'll know the numbers, because right now we actually don't know the exact numbers we have. Secondly, we'll be able to counsel them, we'll be able to advise them, and so, as you say, to be able to reduce the numbers of babies with sickle cell being born, that is how we'll be able to do it. Let's people get to know their status and the counseling and what to do about it, and then destigmatize this whole disease.
Okay, that's great. Joe, it involves, thank God, thank you God, that at least you've not had a crisis for 2 years, he said that.
That is really good.
And I'm thinking, for 2 years, what is it that you have been doing that is different from these other people? And Brian has hit 29, it's no joke, because of the fears that maybe you'll reach 18 and you'll not have you and everything. And also there's the myth behind, which Dr. will clarify, though a bit brief, very fast because of time, that after every 9 years when, I don't know, after 9 years is when you're expecting a sickle that might pass on after another. If they don't die in between 9 years, then it means they have to stay for other like 9 years, you know, such myths that we need to rule out, or maybe to say that yes, it is true. So Joe, what's your secret? And briefly, as the ambassador, also tell us, what is it that you're doing different? Do you feel like the government is doing enough for the people with sickle cell in the country?
No, apparently, I was supposed to die like 6 years ago. When I went to hospital like 6 years ago, I was in crisis, and I was in a coma for like 7 days. And people thought that my life was now limited. I was going to die. It's very weird that doctors tell people who have sickle cell you might die at a certain age. It's not good actually to disclose such kind of information.
I agree.
It's better we keep it to ourselves.
I agree.
Because if I tell you you're going to die tomorrow, you're going to give up.
You will give up.
Apparently, I didn't give up, and I'm now 22. I just turned 22 on August 15th. So, as an ambassador, I'm running a petition in Parliament, in the National Assembly, to declare sickle cell a national health priority. Actually, the information in the petition was meant for the president. I wanted him to talk about sickle cell during the past World Sickle Cell Day. I didn't manage to reach the goal, but I've been running the petition since when I was 19. I've collected a number of signatures. I was supposed to have 100,000. I collected. Honorable Isaac Maura said that the ones I have are enough. So I took the petition, he did the bill. The petition has been pending in Parliament since January this year. But as the petition goes on, I also do advocacy with my brother, my small brother. We also do awareness.
What's the name of your small brother?
Ifyang, he's a
Ifyang the musician. Ah, all right.
Does he also have sickle cell?
No,
he doesn't
not.
have.
He's
All right.
okay. So apart from the petition, I also do awareness. I also represent the African countries that have high numbers of people suffering from sickle cell. I'm running a project known as Face for Africa. I'm trying to face for Africa, for all African countries, so that you can come together and see what we can do for sickle cell. Because managing sickle cell is actually very expensive.
Very expensive.
I can try and get a substantial amount to take care of myself. What about those people who are in the villages,
are not in a position,
who can't even afford to put food on the table? What happens to them? So they give up, they end up dying. I have watched a number of people die. I've watched children die. And I thought I could have done something. I could have done something. But I was not in a position. So I decided that I won't just sit down and watch. I should do something. In Kenya, the number of people who have sickle cell is actually increasing. According to statistics, although we don't have clear statistics, because if you go to all level 5 hospitals, you'll not get a list of people who have sickle cell, those ones who have been treated, those ones who passed on, or those ones who are on treatment. You'll not get such kind of information. So if you ask for the statistics, you'll get different statistics with different people.
All right.
So sickle cell needs to be addressed at a national level. Now the number is increasing. This is a situation that should scare the whole country to sit up. We should not just watch people die. The First Lady of Kenya, Mrs. Margaret Kenyatta, said that her goal is the health for all. I'm actually looking for in that place, because she said that it's health for all. It's health for people who have sickle cell too. So if she wants to advocate for other things like cancer, some diseases like sickle cell are more prevalent, but they are not given the attention it deserves. So we are leading people. Like if I'm a leader, I'm leading people. I cannot lead people who are dying. I'm supposed to, I was thinking that the government should at least locate a higher amount for the Ministry of Health, because if this generation is dying now, who are we going to lead tomorrow? So we should look on the health of the people first before we go on the issues about economy and other stuff. So we come together and think, what are we going to do so that we can improve the health of our people, because we need them for tomorrow.
Okay,
The children of today are the leaders of tomorrow, so we should safeguard their health.
Their health, unfortunately.
And what I do different
time is
about
up, man. Time is up, unfortunately. You can say something very fast as we wind up.
Okay,
Dr. Your face told me that myth behind 9 years and something is not true. I am sure we're going to have this session some other time again, because now time does not allow us. So Brian, I'll allow you to give us the parting shots.
Okay, I can agree with Joe what he has said. Mine is just to request the government, if we can at least have a sickle cell resource center, it will be at least
in
good
all
for
level
sicklers.
5 hospitals. We need to have.
We also need to have easy access to medication. For example, if I'm using hydroxyurea, it is 40 shillings per tablet, and a person is using hydroxyurea according to his weight. So I think if the government reduces from 40 shillings to maybe 20 shillings, it will be enough.
All right.
Another issue of that isolation of doctors telling sicklers that we'll do this. I think as a government we need to train the nurses and the doctors.
And actually the society too.
Yeah,
we
we also need to inform the society. Like for example, I don't need, okay, when I come to you, I tell you that I'm sick, you will just get scared of me because you'll think that I need money. No, as a sickler, I don't need money. I need that encouragement. I need that my pain to go down. Yeah, something like that. So
thank you. Well, Dr. Asante Sana, thank you so much, guys, for finding time to be. I think we need to find more time for this, so that at least everybody down the ground can get to understand. Yes, remember, if you're a sickler back at home, you need to eat well. And anyway, eating well is basically for everyone. Everybody. If you can manage it, why not? Many thanks for always keeping it Ebru TV. Remember, September is Sickle Cell Anemia Awareness Month. We need to create awareness. Remember to donate blood. And if you'd want to reach out to these kids, you know, Sickle Cell Ambassador and also Richard and his wife, you can always reach us on our Facebook page, which is going to run down your screen, and will surely, and of course the SMS line that is also right on your screen, so that we can at least get you to them. Many thanks for always finding it Ebru TV. I'm Linda Alela Matambo.